Hello. Good morning. I'm trying to figure out. Oh, okay. Hopefully, I am showing up as live on Instagram. I'm also on YouTube. Okay. So I wanted to actually pop on here. I was going to come on a little bit later, but I had a patient cancel and move later this morning. So I have time now. So let's chat now. I want to talk about new research that came out on vitamin D. And it wasn't shocking to me, but I figured I would bring it up to you guys because this is something that I talk about all the time with my patients. So let's chat about vitamin D. And I'm going to bring up the study so we can talk about it. I'm hoping to pop on here live a couple times a week to just chat about, what comes up in the news, interesting questions, research, etc., just to give you a little bit more context, a little bit more information. If you were on my mailing list, you got the discount code to my upcoming Better Blood Sugar program. So that is happening June 5th, recorded and live. So if you have not registered, the link's all in my bio if you're in my Instagram. I'm also live on YouTube, and this will be recorded and sent out to my mailing list like everything is. Okay, let's chat about this. So, published on May 2nd, this study is called New Study Challenges One Size Fits All Approach to Vitamin D Supplementation Guidelines. This is not new information to me or my patients, but I thought I would share because, research comes out and I think it is interesting to talk about. So, when we talk about vitamin D dosing, a lot of patients will come in and they'll say, yeah, my vitamin D is low. My doctor told me to take 2,000 international units a day or 1,000 international units a day. And oftentimes I kind of smile because I know from clinical experience that it's just not enough. It just is not enough. And there's like a flip side to this, right? So 1,000 to 2,000 international units per day is more of a maintenance dose. It's more of like, once we get you to your target, this is going to keep you there, right? That 1,000 to 2,000 will be the thing that keeps you there, but it's not going to be the thing that brings your levels up. And people will be like, but it's the summer, but I'm outside all the time, et cetera, et cetera. And really the take home point is we really need to dose based on, I'm just seeing, like, if you're on my live, can you hear me? This is the first time I've done this with StreamYard. I'm just seeing, like, okay, I just went on my own Instagram on my phone and I saw it, so that's fine. So essentially what I want people to do is get a dose that's right for them. And essentially the way that I dose is I will look at your blood results, look at a baseline. Then I'll give you a dose and we'll say, let's do this for the next 3 months. And in 3 months, we'll retest your levels and then we'll see where we're at. Essentially, the goal is to get you as close to around 150. If you're in Ontario, I go by obviously the units here. The goal is to get you to around or as close to 150 as we can. That's the goal. So essentially, how we do that is a number of things. But this study, I'm going to read it so that you can understand, because a lot of people get scared of vitamin D dosing. And you know what? We should proceed with caution. We shouldn't just, drink vitamin D because it is fat soluble. I remember, way back when I used to work at a clinic, and I had overheard the receptionist talking to a patient. This was years ago. I heard the receptionist talking to a patient. She was like, yeah, like I just take whatever amount of vitamin D because I know that you just pee it out after. And I was thinking, no, you literally do not. Vitamin D is fat soluble. So we do have to be aware of that. It is fat soluble, which means that we store it, which means we are not going to pee it out, contrary to that random belief. So we do have to be careful when it comes to dosing, but we do have to dose enough to get our levels up. Like if your levels are under 50, your immune system is suppressed. So it's really important that we take this seriously. Like I've had patients get their energy levels from a 3 to an 8 by simply getting their vitamin D levels up. So the first thing I say to patients, I know you have to pay for the test. It's so annoying, but pay for the test. In Ontario here, we're not covered. Whether you get it through me or you get it through your doctor, you pay for the test. So it just is what it is. But what I tell patients to do is get the test, Get a baseline so we can actually dose you appropriately. Some people try to say, if it's a patient of mine and I say, you're going to take 4,000 IUs a day, which is usually 4 drops. They'll be like, and I'll just give my husband that. And I'm like, I don't recommend that because we don't know what your husband's levels are, right? And, to the contrary, I have patients who will say, oh, well, my husband's a construction worker. He's outside all day. He never wears sunscreen. He's like, farmer's tan and the whole kit and caboodle. And from my experience, I find that just doesn't really matter, honestly. So let's go back to this study because this is what kind of prompted me to talk about this. So going back to this study, it says, new study sheds light on the complexities of achieving optimal vitamin D status across diverse populations, despite substantial research on the determinants of vitamin D, levels of vitamin D, research to believe, blah, blah, blah. I'm just trying to get to the point here. So what they found is they looked at 500,000 participants from the UK, and for each person, they calculated the individualized estimate of how much sunlight level, the UVB they're getting, which is the level that induces vitamin D synthesis in the skin. And what they found is UVB emerges as a critical predictor of vitamin D status, even in a place like UK, which receives relatively little sunlight. What did they say? Okay, this is the most important part, and this is what I talk to my patients about. The second is that age, sex, body mass index, so BMI, cholesterol level, and vitamin D supplementation significantly influence how individuals respond to UVB. For example, as BMI and age increase, the amount of vitamin D produced in response to UVB decreases. So when we're creating a level, when we are dosing someone appropriately, we need to make sure we're taking all these factors into account. So someone could be deficient at the level of I don't know, I've seen levels as low as 23. The lower limit here in Canada is actually, 75. And below 50, we know your immune system is going to be suppressed. So I've seen people at 23, 33. And in order to get them up to where they need to be, I will dose a lot more heroic doses if someone is more overweight. So someone who is deficient and in a smaller body, I might give them 5,000 IUs or 6,000 IUs, and that might be quite a bit for them. And for someone who's larger, I might give them up to 10. Now, often I'm not giving them more than 10. Typically, I'm giving them 10, and then we're, going from there. But it's important to know that vitamin D over a certain threshold is a drug. You do need a prescribing license in order to make that recommendation because we are dealing with things that need to be monitored and tested. So a lot of patients will come to me nervous about taking vitamin D potentially at that dose, but I'll tell them, well, we are treating and monitoring. So we'll see how quickly, again, there's genetic factors at play. There's a lot of different things at play that will interfere. So like I said, if you have a larger BMI, you're not going to make vitamin D as efficiently as somebody who has a lower BMI. So you could be exposed to the same sunlight at the same time of day, no sunscreen, all the recommendations, but you actually won't make vitamin D the same way as someone else. And it's strange that it took this long for this study to come out. However, I think it's a really great movement in the right direction because we are historically underdosing vitamin D. I find that there's really no in between. Patients are either overdosing vitamin D or underdosing vitamin D. And there's really no one size fits all. Like I said, as a maintenance, we might do 1,000 to 2,000, but even that might not be enough depending on your specific needs, right? So I'll have patients test. We treat till we get to our target. Like I said, my target is usually 150. And then after we hit that target, I'll bring them back down and I'll say, okay, so now that you're at the target, we're going to put you at, 2,000. I might make just an educated recommendation of 2,000 to 3,000 IUs per day. And then I'll say, let's go a full 4 seasons, specifically here in Canada, where we have a variety of levels of sun exposure. And then I'll say, okay, once we've gone that full 4 seasons, we'll retest and we'll see how that maintenance dose did for you over the course of a year. Because if over the course of a year, we were able to maintain that 150 or around 150, then that's a really good maintenance dose for you. And then essentially when we're doing, additional dosing over, like normally I'll put anything over about 6,000 international units. I want to see vitamin K2 dosed with it because vitamin K2 plays a role in the metabolism of vitamin D. And as we're dosing more and more, we need to make sure that we're actually supporting that metabolism of the vitamin D in addition to that. So that's the long and short of it when it comes to vitamin D. But I thought that was interesting to come on here and just talk about it briefly so that you guys could understand that it is very nuanced. It's not like, oh, just take it and move on. It's take it, get the dose that's appropriate for you. So test your levels, take it for 3 months. Some patients I even do less. I've even done, you can get prescriptions for gel caps of vitamin D. And so I'll do like a 10,000 IU gel cap. I might do a loading dose. So for those patients who are in the, 20s, I might say, I want you to do a loading dose of, 1 cap a day for 12 days of that 10,000. Like I want to do, or I might do 25,000 a day for 10 days and then go back down, right? We have to make it very individualized to your needs, your body mass index, your age, your sun exposure. But the fact of the matter is we're looking at, it's a beautiful day today. The sun is out, but that does not mean that you will make enough vitamin D. I complained to my family doctor about low energy and got blood tests, and all they told me is that they saw low vitamin D and they weren't sure why I was tired. Yeah, that's super common, right? Vitamin D is, in my experience, a really common reason for low energy. Even for myself, I had tested my vitamin D a couple years ago, being like, mine won't be low. And not that I was taking vitamin D or spending any amount of time in the sunlight, but I just thought, oh yeah, no, mine just won't be low. And it was super low. So getting myself to appropriate levels was actually a huge goal of mine. And I found personally, it gave me that like pep in my step. So when people talk about getting up in the morning and like dragging themselves out of bed, I found that when I got my vitamin D levels up, and similarly, I've seen with patients when they get their vitamin D levels up, they're having more of that pep in their step as well. So really getting, I'll look at a patient, I look at a number of factors before I dose. So if your levels are low, I would first of all get a copy of that. But also there's other reasons for fatigue. So would vitamin D help your body? Oh, my computer was going to go dark. Would vitamin D help your body protect you from the damaging effects of the sun, since as we age, our body doesn't deal well with it? That's actually a really interesting question. And I don't know the answer to it. That would be something I'd have to look at, because I don't know if taking vitamin D can actually protect us externally. But that's a very interesting question that I've never been asked. So let me actually dive into that, because if I could find information about that topic, that would be really cool. Vitamin D, skin, because I don't know if externally it protects. Now, I'm a huge advocate for SPF. I don't love the sunscreens out there. We know that sun exposure leads to melanomas and, negative stuff, hyperpigmentation and everything on our skin. So I think when we look at, going out in the sun, it's counterintuitive, right? We're putting on sunscreen and we're like, well, we can't get sun exposure and, et cetera. So I think that especially when you live in this area of the world, you're going to probably be dosing, I'm not a huge advocate for forever supplements, but I do think that vitamin D is probably one of those that we would do forever. Newborn, the standard recommendation is 400 IUs. If you ask your midwife or your OB, you'll usually do a 400 IU, especially for breastfed babies. And I usually will make like individual recommendations based on if a patient has something specific or whatever else, or I'll talk about my personal dosing with my personal children, but that is not a professional recommendation. And that is not something I will chat about here, but 400 IUs. So usually they come in like the baby D drops you can buy, and it will be at a lower dose. All right, well, I got a jet because I have patients coming up, but I actually hope to do this more, like a few times a week, just chat about stuff I see in the news, health related, or an article that catches my eye, just to come on and give you guys some info. And if you're on my mailing list, you'll get the replay if you didn't see the whole thing. I'm going to see if I can post it on my Instagram. I don't know. I've never done this through StreamYard because I'm on my computer on Instagram, which is a weird thing. So I don't know what's going to happen when I end it. But anyways, hope everybody enjoys the sunshine. I will pop on, I don't know, see if I can pop on tomorrow. We have puppy school and lots of things, but we'll see if I can do like a quick 10-minute. Otherwise, have a great day. Too bad to view this in your archive. I'm just seeing, like, if you're on my live, can you hear me? This is the